Imagine a childhood where love is twisted into a weapon, where care becomes abuse, and where illness is a fabricated reality. This is the world of Munchausen Syndrome by proxy survivors. Munchausen Syndrome by proxy is a severe form of child abuse that often flies under the radar. It's a psychological disorder where a caregiver, typically a parent, fabricates or induces illness in a dependent person, usually their child. First, MSBP operates through a complex web of deception and manipulation. 1. Fabrication. The abuser invents symptoms or exaggerates minor issues, often providing detailed and convincing accounts of false medical histories. 2. Induction. In more severe cases, they may actually cause illness through poisoning, medication overdose, suffocation, or other harmful actions. 3. Medical shopping. They seek multiple medical opinions, often ignoring evidence that contradicts their narrative. This may involve frequent changes in healthcare providers or visits to different hospitals. 4. Isolation. The child is kept away from others who might question the situation, limiting their social interactions and often homeschooling to avoid scrutiny. 5. Gaslighting. The victim is made to doubt their own perceptions and experiences, creating confusion about their actual health status. 6. Attention-seeking. The abuser thrives on the attention and sympathy from medical professionals, family, and community members. 7. Role reversal. The caregiver assumes the role of the heroic, self-sacrificing parent, while the child becomes a prop in their performance. 8. Manipulation of medical staff. The abuser may forge friendly relationships with healthcare providers to gain their trust and manipulate their perceptions. 9. Selective reporting. They may exaggerate certain symptoms while omitting important information that doesn't fit their narrative. 10. Interference with treatment. The abuser may tamper with medical equipment, medication, or test results to create false evidence of illness. 11. Emotional coercion. The child is often made to feel guilty for causing so much trouble, reinforcing their compliance with the abuser's narrative. 12. Creation of dependency. The abuser fosters an unhealthy dependence, making the child believe they need constant medical care to survive. 13. Triangulation. The abuser may pit different medical professionals or family members against each other to maintain control of the narrative. 14. Documentation manipulation. They may keep detailed medical diaries or blogs, often exaggerating or falsifying information for attention or financial gain. 15. Financial exploitation. In some cases, the abuser may seek financial benefits through disability claims or charitable donations. This intricate web of deception can make MSBP incredibly difficult to detect and address. It requires a high level of awareness and often a multidisciplinary approach to identify and intervene in cases of MSBP. Recognizing the signs. If you're questioning your past or concerned about someone you know, look for these red flags. Persistent, unexplained medical issues that don't respond to treatment as expected. A caregiver who seems too comfortable or knowledgeable in medical settings. Symptoms that only appear when the suspected abuser is present. A child who's unusually comfortable with invasive medical procedures. A dramatic improvement in the child's condition when separated from the caregiver. The caregiver constantly seeks attention and sympathy for the child's condition. A history of mysterious illnesses or deaths in siblings. The caregiver appears more concerned with medical staff's reactions than the child's comfort. Inconsistencies in the caregiver's reports of symptoms or medical history. The child's reported symptoms don't match objective medical findings. The caregiver is overly eager for medical tests and procedures, even invasive ones. The caregiver maintains an unusually close relationship with medical staff. There's a history of the caregiver having unusual or unexplained illnesses themselves. Other family members express concern about the child's frequent illnesses or the caregiver's behavior. The child shows signs of fear, anxiety, or discomfort around the caregiver, or the very opposite is true. Remember, the presence of one or even several of these signs doesn't automatically indicate MSBP. However, if you notice a pattern of these behaviors, it's crucial to take action. Your intuition is valid. If you're seeing this and feeling a spark of recognition, listen to that inner voice, that nagging feeling that something isn't right. Statistics show that the abuser is usually the mother. So, taking that into account, if you're a father and things just never seem to improve with your children's health, Remain alert and seek urgent professional help. The insidious nature of MSBP often makes it impossible for children to recognize or speak out about their abuse. They're trapped in a reality constructed by their abuser, often too young or too manipulated to understand what's happening. This is why the responsibility frequently falls on the adults surrounding these children to recognize the signs and take action. If you're a teacher, family friend, relative, or any adult who interacts with children, 1. Trust your instincts. If something feels off about a child's recurring medical issues or a caregiver's behavior, don't dismiss your concerns. 2. Document your observations. Keep a record of incidents, behaviors, or statements that raise red flags. 3. Consult with colleagues. If you're in a professional setting, discuss your concerns with trusted coworkers who may have additional insights. 4. Report your concerns. Don't hesitate to contact Child Protective Services or law enforcement if you suspect abuse. You don't need proof to report, just reasonable suspicion. 5. Maintain involvement. Even after reporting, stay engaged and continue to document any ongoing concerns. It's crucial to understand that many professionals, including social workers, psychiatrists, and even some medical doctors, may not be well versed in recognizing MSBP. This disorder is often misunderstood or overlooked due to its complex and deceptive nature. To address this, 1. Education is key. If you're a professional working with children, seek out specialized training on MSBP. Advocate for increased awareness within your organization. 2. Interdisciplinary approach. MSBP cases often require collaboration between medical professionals, mental health experts, social services, and law enforcement. Push for a team approach when you suspect MSBP. 3. Challenge assumptions. Be willing to question diagnoses, especially when a child's symptoms don't align with typical presentation or don't respond to treatment as expected. 4. Listen to the child. Create safe spaces for children to speak freely away from their caregivers. Pay attention to nonverbal cues and behavioral changes. 5. Consult experts. If you suspect MSBP but feel out of your depth, don't hesitate to consult with professionals who specialize in this form of abuse. 6. Advocate for policy changes. Push for better screening protocols and increased MSBP awareness in your professional organizations and institutions. Remember, identifying and addressing MSBP often requires breaking through layers of deception and deeply ingrained systemic beliefs. It's a challenging process, but one that can literally save lives. Your vigilance, willingness to speak up, and persistence in seeking help can be the lifeline a child desperately needs. To survivors on the path to healing, your strength is awe-inspiring. Every step you take towards reclaiming your life is a victory. You are rewriting your story, and it's a story of triumph. Remember, the legacy of MSBP doesn't have to be endless suffering. It can be a springboard for growth, a catalyst for change, and a testament to the incredible resilience of the human spirit. It's a journey, often challenging, but infinitely worthwhile. Here are some steps to consider. 1. Seek professional help. Find a therapist experienced in treating MSBP survivors. They can help you unpack your experiences and develop coping strategies. 2. Reclaim your health. Learn to trust your body again. Work with medical professionals to understand your true health status and needs. 3. Build a support network. Connect with other survivors. Join support groups or online communities where you can share your experiences and find understanding. 4. Educate yourself. Understanding MSBP can help you make sense of your past and recognize that the abuse wasn't your fault. 5. Practice self-compassion. Be patient with yourself. Healing isn't linear, and setbacks are normal. 6. Explore your identity. Discover who you are beyond the role of a sick child. Pursue interests and passions that were denied to you before. 7. Set boundaries. Learn to establish and maintain healthy boundaries in relationships. 8. Consider legal action. If appropriate, explore legal options for holding your abuser accountable. To those who have survived MSBP and are now recognizing their past experiences, your realization is the first step towards healing. It's normal to feel overwhelmed, confused, or doubtful. Seek support from trauma-informed professionals who understand the unique challenges of MSBP survivors. Your journey to recovery is valid, and you deserve compassionate, knowledgeable care as you navigate this complex healing process. Your journey to healing and self-discovery starts now. Take that first step. Reach out for support. Believe in the strength within you. You've survived the unimaginable. Now it's time to build the life you deserve. Your truth matters. Your healing matters. You matter. Thank you so much for watching.